So in a simple way, we start with methods that support, like we agree, slow aging and stimulate each structure. And only later, usually at the very end of the therapy, to introduce the derma filler, which is the stage, of course, when we sometimes have to and might be helpful. And I will also talk this about today. Right, so tissue regeneration is tissue stimulation, okay? But stimulation based on smart work and on doing things in the, I would say, right order. Today we know that our tissue stimulators influence cellular metabolism, most of all influence an anabolic properties of fibroblast. We stimulate not only the proliferation of fibroblast, but at the same time at every function of the fibroblast. Fibroblast, if is someone who needs little refresher, are cells which with age become, if we compare it like a grape and a raisin, I'm talking about in here dehydration of the cell. This is more or less the process that happened to our fibroblasts. They become shrunken and not very productive. So our role is not only to take care of having the right number of fibroblasts, but also, this is extremely important, to make sure to stimulate those fibroblasts that are still there. Because as we know, they're getting lazy with the age, they shrink, they cannot really do that much work how they used to do, because the energy level going down as well with our age. So remember that stimulation also means antioxidant activity and stimulation of cell division. And first at all, we need to remember that fibroblasts are suspended in extracellular matrix. And this, what I think, is the most problematic subject, especially if we want to have really quick and good results after our treatments. Why? I'm gonna try to explain you as simplest I can, okay? So if you're gonna imagine, we have exactly like having the fish tank with beautiful fish inside. And imagine that you forgot to put the water inside the fish tank, okay? But what you do instead is put the food to the fish, because we expect them to start reproducing and growing, and we trying to make our fish do everything in a wonderful way. But think, we all know that, and we have to be aware of that. Until we won't put the water into the fish tank, no matter how good quality food we're gonna give to our fish, they will do nothing. They will, I would say, live a little bit and will die, unfortunately. So when we transfer this to our tissue, remember our fibroblasts are suspended in extracellular matrix. And first, what we have to do, we have to make our extracellular matrix really good. The quality, we have to level it up. We have to hydrate the tissue. So before we can really stimulate the fibroblast and achieve anything. And that's why 90% treatments which we're supposed to start with is a mesotherapy. Mesotherapy, which contained all the hydration properties, active ingredients, which allow us to build ecosystem for our fibroblast. And this is not only for stimulation, we have to remember, because if you have a clinic and you're using lasers or using devices, this is exactly the same. We still want to proliferate fibroblasts. So even if we're gonna do laser treatments, first, I would say preparation with mesotherapy, it will be really, really beneficial for the improvement of the tissue, because as we know, that fibroblasts need to have environment to do it. So it doesn't matter, do we stimulate with like injectable stimulators, or we use laser, or we use devices. First, we have to prepare the ecosystem for our fibroblasts. So this is the first element we need to understand. And the second thing is that we have the whole group of ingredients called tissue stimulators, of course. We have polylactic acid, we have a hydroxyapatite, we have prolycoprolactone. So we have wide range of stimulators. And this is very broad and very, I would say, interesting to remember that most tissue stimulators, and this is like extremely important, lead to the production the type 1 collagen only. But as we know, we need in our tissue, and we know that the tissue needs not only type 1 collagen, which is the fibrosis collagen that thicken the tissue, but we also need type 3 collagen, the highly elastic one, which is responsible for the young full of the tissue and, like, I would say, like more bouncy texture of our face. This is kind of like if you imagine like child face and you trying to grab the skin of the child, you can't do it. It's like really bouncy. Your fingers cannot really pull the skin, and this is what is called collagen type 3, which is called the young collagen, because the kids having the young collagen really, I would say, high amount. That's why the skin is so bouncy, and this is really important. We actually creating the both type of collagen instead of only the collagen type 1, because we can make our skin more thick, and I would say that will be more structured. But if we don't have this like elastic bouncy structure, doesn't really I would say look good in the older age. So if we would like to create the collagen type 3, of course, we have to choose the active ingredients. For sure, fragments of hyaluronic acid between 20 to 40 monomers, which does the excellent job because it acts on CD44 receptors on fibroblasts. And here we have the whole V line of products, V1, V2, V body, and VI, which are created, and the base is fragments of hyaluronic acid. So it's really great, I would say, line to indicate that needs of our skin. And I would like to mention also about succinic acid, so in infini amber. I don't really plan to use it today in the treatment, but I would like to mention that because I think it's like amazing product, and I cannot really imagine my everyday work from my everyday work without this product. So succinic acid, which I consider one of the truly and very interesting tissue stimulators, is a fantastic influence on our vessels and the lowering inflammatory cytokines. So this is really important for me, because if I have a patient with redness, with mild stages of rosacea, I can very easily heal this inflammation down using the amber and succinic acid. So I would highly recommend to use amber with the cannula if you have really sensitivity on the patients, or like I said, mild rosacea. It will beautifully calm it down after first treatment. And also works wonder with micro circulation. We have to remember that. So even if we have some problem with a lymphatic drainage around the eyes, that would help that too. And I prepared the slide for you, so probably you all know that, but I always say the refreshers are good. So I prepared like what happened after injection. So through the injection process, of course, our task is to activate the fibroblast, like I mentioned before. This means we aim to increase the proliferation and increase the production of collagen, elastin, and hyaluronic acid, so extracellular matrix. And here I would like to pause for the moment, because we have to remember stimulation and collagen production are not only the good direction. Let's take a scar, for example. So we must remember that the scar is nothing else than collagen. And if we not care only, if we're gonna care only about the collagen production, we cannot really get in good results. Like I said with the collagen type 1 and collagen type 3, very important is also stimulation for the elastin fibers, because like we know, the elasticity of the skin is really important. And what's happening with elastin, those fibers are really difficult to recreate them when they're gone. So for me, the most important thing is actually preventing before they even start slowing down, because I know how hard, and I know from my own experience how hard is actually recreate them. And when I was trying to do that, because in my personal journey with my skin, my glycation level is really high. So that means free radicals in my body is crazy high. I trying to lower down as much I can, but sometimes we cannot really do that. The genetics. So I remember when I start work with my skin in the age when I was 26 and 27, and everything was dragged down. The first thing I was trying to actually rebuild the elastin, because I knew if I'm not gonna start there, I'm not gonna have a chance to actually rebuild anything. And the age 26, 27, that's the age when the metabolism of our cells they quite high. So we still have a chance to rebuild that, because the division of the cells is and turnover of the cells is quite quick. The worst is when I'm now 42. So I think I wouldn't be manage achieve this effect if I would start now. So the mechanism of regeneration, when we actually damage the skin, what's happening? We have inflammation, we have tissue injury, where we introduce the product, we have a proliferation, and then we have a tissue remodeling. So inflammation phase usually takes around 24 to 48 hours. It depends how quick we feel, and we can be little like swelling, little redness. This is absolutely normal after treatment. Then we have a proliferation phase, which usually takes around 3 weeks, and that's the time when we see visual effects of our skin density. We have quite a hydration level up, and the skin start actually work again. And then remodeling phase is up to 12 weeks, more or less. Of course, that all depends of the lifestyle of our patient. And this is why I always showing this slide actually to my patient, because they have to understand they cannot really expect the effects from the tissue stimulations for 2 or 3 days like we usually have after fillers or even toxins. We need to wait a little bit because we rebuild everything. And usually, like I mentioned, 3 weeks, that's the pace for proliferation. And this is exactly when the patients come in for second or third treatment, they're usually saying, oh, after the second treatment, my skin looks so good. And then I explained, no, the first treatment, actually the start works. So that's why you can see the results. And the best, and I would say most, what we can get from the therapy, you can see effects around 1 month after complete therapy. So I usually do 4 treatments every 3-4 weeks. It depends which product I use. If I use, for example, V5, I do treatments every 4 weeks, because that's contained trehalose. I'm gonna go through the products in a second. So the best results we can expect around 1 month after therapy.
Vieš, to je marketingová záležitosť.
And also I would like to mention about the receptor CD44 on the fibroblast, because I think still
pol roka sú ešte nevedení, deje sa veľa.
It's not that many informations about that, and this receptor is very important, because that's the only receptor actually we can push the button and recreate the collagen type 3, which I personally love. And I will try to explain you that in very easy way. So let's say some ingredients have the perfect key for this receptor, okay? So, and some of them simply not have the perfect key. And fragments of hyaluronic acid, those in between 20 to 40 monomers, they not only form of this fits the receptor,
Ja sa to asi budem
but they
musieť
actually having
nascreenshotovať a
like the
normálne
key for the
preložiť,
lock,
aby som to
okay?
vedela úplne
So
poriadne.
regular hyaluronic acid, that's the normal one, does not fit.
Oni to
Fragments of hyaluronic acid,
to je nahralo.
they perfectly match. So receptor CD44, which is creating collagen type 3, the only two actually treatments we can stimulate this receptor with, and that's the treatments which contained fragments of hyaluronic acid, like whole line of V line, VI, V1, V2, and V body, and also PRP. PRP also giving us collagen type 3 stimulation. So if you have a patients, for example, which they cannot really have any other products because they allergy or they like pregnant, you can still do it, and you can actually have that exactly the same effect using the PRP. And now we move to the aging process within the facial structures, because this is what we actually, I would like to focus on today. And this is require understanding the very, very important things, okay? Because so many years, we were all used the idea that stimulate the skin, okay? We was doing the mesotherapy of the skin, and in general, our whole treatment approach was, and the patient was focused mainly on the skin. And today, we know this skin is only the outer layer, and covering the layer which skin is, that's covering something which is deeply inside in our skin, and those deeper tissue age just as much as skin does. So we cannot really only stimulate the skin now, and this is like explaining really nicely, and I highly recommend you to actually go and find those information. According to Dr. Stephen Weiner, who compares the layer of the face to the layered cake. And if you noticed one thing, the skin is like beautiful smooth icing on the top of the cake. But if anything start to collapse in any of the layers underneath, and you will pull one of the layers out, that cake will and the beautiful icing on the top, probably it will crack straight away. We cannot really keep nice, beautiful, smooth icing if we're losing some layers. But if anything starts to collapse in any of those layers underneath, or if you are trying to pull even one layer, so let's go through to this process, and let's go layer by layer, because now we have, I would say, solutions for every layer. So I'm gonna go through with you this today, and I'm really excited about, because since I start working with this kind of approach, I have much more better results with my patients, and also I don't really need to see them that often in a clinic. So let's start from the skin, because as we know, the skin, of course, dermis, epidermis, and I think all of you here are specialized, and you are specialists, so you know perfectly well. And we know we have the reduction of collagen and elastin, I will mention before. We have a drop in production of degradation of the fibers. We know that the fibroblast activity becomes very limited, and we know that the structure of the extracellular matrix become disturbed. So all those elements that simply attack appearance of our patients, and because suddenly there is, I would say, too low amount elastic resilience fiber, these skins become dehydrated, and then those deficiencies start appear. So this skin simply cannot look good. And unfortunately, I fully agree with the statement, which is exactly where I actually start. We have to educate the patient, I would say, from the basics, because sometimes I think we approach to them and we think they know exactly the same amount of like informations we have, and they don't. Most of the people even don't know from age 25 to 30. We're losing around 1% of collagen every year. They don't know now. Seriously, I thought everyone knows that. All the social media are full of those informations, and I still getting the patients which I start in that, and I think, oh my god, what are I gonna be talking about? They probably know all of that. They say, oh, I'm sorry, I didn't know. So we cannot really expect from our patients having exactly that same knowledge. And even if they know that, I think it's our work to remind them this information, and the knowledge which we have needs to be shared, because this is really important, especially of those days when the food quality is not that good, when the air purity is not great too. We have very, very high stress level. We not really sleep well, and we all know this is also have a massive impact on our collagen fibers. So we're losing around 1% of the collagen every year. And please remember that, and this is really important, extremely, I would say, important, during the menopause, the women, they lose an additional 25 to 30%. So now imagine a situation when we have a patient which has never stimulated skin, do no treatment, do nothing, has not done, let's say, till 50 years old. That's the around the age when we're going through the menopause process. By that time, she's already lost around 25% of her collagen, and then enter menopause stage, another 25% disappear, which means she lost 50% of the collagen. And this is really dramatic situation for the skin. Those are the patients who come and usually say, doctor, everything has fallen down and I don't know what to do. I was trying to drink collagen, I was trying the creams, and nothing helped. Of course, nothing helped, because we don't really have something which will support our skin. And usually what we can do, what we can do if we have no longer around 50% of the collagen to work with. And this is why, please remember that before menopause, our patient should already be prepared by us, and the skin condition before entering the menopause should be at the best, and I would say absolutely best condition. So when the menopause process hit, the damages won't be that high, because we will have still strong amount of the collagen in our skin. And when we talk about the skin laxity, one thing is very important. Of course, like I mentioned before, we must work at the level of the fibroblast. CD44 is our main receptor, and only fragments of hyaluronic acid is able to unlock it. Okay? And once this receptor is activated, the fibroblasts start to behave like perfectly programmed young cells, proliferation increase, and the production of type 1 and type 3 collagen also increase. But we have to also remember that when we inject in the dermis, we have to be in correct depth. Because if we're gonna go through all the medical books for even, I would say, 5-6 years ago, all the medical books and all the atlases, anatomy atlases, showing us the dermis around 3 to 4 millimeters depth, the depth. And now we know this is not true, because the all ultrasound or even the cadavers, which we actually have a lot of science now, clearly saying dermis is around 1.6, 1.8 millimeter depth. So that means when we inject in 3 to 4 millimeter inside, we are already in subcutaneous fat or sometimes even in the muscle. So we cannot really achieve the great result of the even
Beline je taká
skin,
lepšia rada, hej?
I would say,
lebo je-
stimulation because
Toto by
we're
som
not
ako
putting
povedala, že
the
nedávam, že toto nie.
product in incorrect layer.
Hovorí od začiatku.
And if we want to be in correct layer, we need to remember the only needle, that's the tool which we actually can use, because there is no chance, even using 25K Gersh cannula, with bevel up when we're releasing the product, be in the dermis. We're gonna be in between dermis and we in and subcutaneous fat. So this is really important to understand if we want to stimulate the skin, like a dermis, we have to use the needle. And the needle to the correct plane. So for example, if we have like a 4 millimeter needle, we usually go in around 45-degree angle, and when we put in around half of the needle, we're gonna be in correct depth 1.6, 1.8. Bevel always, of course, up, because we need to release the product to the dermis, not to the subcutaneous fat.
Ti tak saje, alebo píchaš po tú kožu.
And when we talk about the laxity, one of the most, I would say, complete product we have available today is Infini F6. And I will explain to you quickly why. I was waiting for this product for so long, and I really, really love it. So I just have a little bit of water. All right, so why is so different? So this is not, I would say, standard collagen cocktail. This is a formulation designed to target all 3 pillars of young full skin at the same time. So we have type 1 collagen, type 3 collagen, and elastin. So the combination is something we very rarely see in mesotherapy, because usually we have components which cover one on the other. F6 work deep within the, I would say, the matrix. So we have hyaluronic acid, we have soluble collagen, we have hydrolyzed collagen, and amino acid, which together form a complete set of building blocks and energy sources for fibroblast to need to actually truly work, because this is our clue for stimulation, and it's giving the cells. So we actually given our cells complete, I would say, designing plan with building materials and also with whole, I would say, the team to rebuild it. You can also take the screenshot if you would like to. That's the loads of information I put on the slides, so they really, really handy to have them, even like for, like I said, for the refreshing and to go back to them. F6 also contain resin hydrolyzed collagen and soluble collagen cross polymer. Okay, so ingredients, those two ingredients together are stabilized to I would say early form of the collagen, meaning that stage that most products never actually reach. And this is why the clinical effects of F6 are deeper, more defined, and much long lasting. So if we had to choose one product for, I would say, work with the skin laxity, Infini F6 would be one of the strongest tools, because it doesn't only address the symptom, but also goes straight to the root of the problem. So like I said, we have hyaluronic acid production, we have elastin production, we have a collagen production, and also we have antioxidant, I would say, shield for that. And F6 comes in two forms, a 3 ml syringe and 10 ml vial. And this is not only, I would say, just about different packaging, they simply have different concentration and work in slightly different way. So 3 ml syringe are a little bit stronger, more focused stimulators. The syringe has, I would say, higher concentration of active ingredients, so it gives the tissue a much stronger and very focused signals. I use it when I want to work precisely, when I see local laxity, a specific area that needs density, fine atrophic lines, or small depression in the skin. Because the higher concentration means a stronger push for the fibroblast, exactly in the place where we need this little reconstruction. And the vial has a little bit lower concentration per ml, but we
Ja si
get
to
a
tak...
much and bigger
Takže
volume.
doložím a odfotím
And
na
that
zábava.
allows us to
Jo,
work
bo to
with
si
the
ještě, že
environment
to
of
ti
the
rovno
skin,
pokládá.
not just on the one point is perfect
Keď
when
si
the
šla ty
skin
veci,
looks
tak-
Ja, keď
tired,
ty do roboty ich baví,
dehydrated,
potom vedia o tom
when
niečo.
No, už
elasticity
teraz
is
tá slova, ešte myslím,
reducted
že
like
to-
everywhere, not
takto,
only on a
akože úplne
small
celé, toto
area.
na-
So the vial help us
Okay.
rebuild the extracellular matrix globally of the tissue and evenly across the large area. It's like, I would say, restarting the condition of the whole tissue. So in
Príklad.
the simplest way,
Tu máš.
the syringe gives us a strong targeted stimulation, and the vial
No, môžeš
help
to
us
nastaviť
restore
predtým,
the
že ti to
whole
automaticky
ecosystem
bude
of the
prepojené,
skin.
ale
So
nepýta sa to v celku,
the
že keby
mechanism
niečo
are
chceš si
exactly the
nastaviť.
same. The different is the concentration and the
dobré
purpose.
fotografie.
And I
Potom
really,
dáva
really
reklamu,
like the
dobre.
product I'm using a
Ja
lot
dobre
for
slovo.
the
Dobre.
neck and
Skúšať
décolleté
cez Google?
because you have
Nie,
beautiful
čo-
effect
ChatGPT.
after
Á,
first treatment.
jasné.
Please try on the
Vieš, potom
neck
je
and
dobre to
décolleté,
nahrať,
especially for
vieš, a
someone
potom
who's
iba
got
to
quite
No, ale to
deep
nedávam
lines
ja takto,
and
ale-
very,
Nie,
very,
píše
I would
na
say,
hrdinú
loose
takto,
skin. I
a
have this
potom
kind
ona
of
nech si to
like
už
neck
robí,
and
nech si
lots
to
of my
prepisuje,
clients
tým sa to pádom
and
učí.
patients.
A
So
má
please
všetko,
try that and
vieš.
let me know how it's go because I have amazing results and all my
No, to
patients
trošku
really, really
zdlhavý
like
takto,
it.
ale má to akože v pohode. Také tie...
Another element that goes through a very clear aging process are, of course, ligaments. And today, in fact, we have, that's really, really excited. I love all those, I would say, scientific news because this is, I think, quite new from 2 months ago. This theory come up. So basically, scientists, all the science look at this on two different ways. The first,
Nechytá mi to teraz.
that was the first
Vieš,
one
musím to
which
vypnúť.
we knew that a few
Čo?
months ago. The first way say that become
No,
ligaments
položím.
are connective tissue structures. When the collagen level drop and fibroblast slightly goes down, the ligaments become more stretched and they simply do not hold the tissue the way they should. Okay, but the second group of they said
No,
something
to sa
completely
blíži akože
different.
k jalúchru,
So
ale
they
to
said
akože
it's not only about the
čelníkom
stretching of the
budú
connecting tissue
akože
itself, but it also connected to the movement of the 42 bones in our facial skeleton, which damage with which change with age, become flatter, shift, and also reposition the position of the bone. So we also have the classic process of bone loss. And we must remember that osteoporosis also affect the bone of the face. So when a bone rotate and change shape, the ligaments which is attached to the periosteum and at the same time connected to the skin suddenly has a different anchor point. And this is very important element because when the bone rotates, the ligaments automatically behave differently, okay? So in reality, both groups of science are right. And after analyzing this topic very broadly, because I love, like I said, those kind of news, I can tell for me, it actually doesn't matter which process, which first or second process is correct, because we all know we have to stimulate the fibroblast because otherwise they get weaker and they cannot really hold all 3D compartmentation of our cells.
Neviem, ale akože ja keď som
Neviem,
bola
ani
s
ja, že sa
Alanom,
ťa
tak
opýtam.
nám nechodili babi, že by reklamovali pery.
No Karin hovorila, že veľa reklam.
So this is absolutely crucial when we talk about the, I would say, tissue sliding downward, especially when the static area of the face begins to fall into the dynamic areas of the face. And we have to remember that in another way important concept here, like we can see, we have a functional ligaments line, which is
Akože,
separate the static part of the face from the dynamic. We
čo
have
ti ja
a
poviem, neviem,
static
proste
face
filler
on the
nepoužívam.
when we sleep on, and we have a dynamic
Nepoužívam.
when
Ja
we
som
can
len
see
počula.
and we
A
can move all
mezošky,
our
no tak
muscles
majú
on
zase,
all our
majú oni
tissues.
strašne veľký výber mezošiek, to nemá nikto. Vieš, že šeličo.
So dynamic our area of the face, we have to remember that acts as a
Janka
support.
Košová hovorila,
So
že
if tissue from the static parts slide into dynamic part, this never is a good sign. Because this is exactly the moment when the mid-face begin to drop, the nasolabial fold become deeper and the marionette lines become more appear, and that's the first jaw start to form. So when we talk about the facial aging and slow aging, and we want to slow down and I would say interrupt one of the key mechanisms is differently, and firstly is look after the ligaments.
Ja neviem, takú péru vôbec nie peknú.
And yes, we can stimulate the ligaments because they build from the collagen, from fibroblasts. So if we have the collagen that the tissue can produce, and if we have a fibroblast that I can stimulate, it means I can support those structures. So even if the bone underneath is shifting or rotating with age, I can still hold the ligaments, keep the much it is elasticity and holding compatibility as possible. As you can see in here, we have a lot of ligaments. But remember that we have true ligaments and full ligaments, so those are two types. We care about both, of course, but the main supportive strength become from the true ligaments. And for example, you can see here the ligaments supporting the orbital area, and this ligament is extremely important. And this is something we talk about a lot, and I don't know if you're aware, but if the stability of this and the quality of these ligaments are not maintained, and you place a filler into the teardrop, in many cases this leads to irreversible damage of that ligament. And in result, in this patient, the teardrop won't improve, the filler probably will migrate, and the ligament cannot be repaired anymore. So for me, I would say supporting ligaments, that's the always first treatment which I always start with. And even if I do the teardrop, first treatment I support in the ligament, and then after 2 weeks I book in the teardrop appointment.
Musím povedať len to, že strašne veľa od pier závisí len technika.
So when we work with ligaments, we need to and we need the products that are very dense, and because they have to stay exactly where we place them. A ligament is really narrow, linear structure, and so the product cannot spread on the side. It must remain in the precise anatomical line. So this is very important when we inject those products retrograde, starting right from the periosteum and moving all the way backwards to the dermis. And and thus the product must hold the position in every layer on the way up. So because our goal is the full regeneration and reinforcement of the entire ligament pathway. So if we're gonna use product which is spread a lot, it won't stay in the very thin structure. So in here I put some my favorite product which I use for stimulation of the ligaments, and we have infini V5, infini PDRN, L, V20, F5 and Mesoplast. So how you can see that all very thick and dense products. And when we talk about stimulating deeper structures, especially ligaments, my first choice is usually infini V5. And this is not a standard stimulator. This is like, I would say, contour stimulator designed with a very specific purpose. It provides stability, support, and long-lasting biological activity exact in the place when we inject that product. And this is why I call
Vieš,
this
v
an
Rakúsku je-
reveal queen of
v Rakúsku
stimulation.
je
And the
fabrika.
reason is very simple. The formula combines two molecule weights of HA and 20 milligrams of trehalose. So let's start with HA. So large HA molecules create scaffold, lifting frame that support the tissue and hold a structure. Then we have a small HA, which penetrate much deeper and stimulate fibroblasts to produce fresh type 1 collagen. And then we have a trehalose, a stabilizing molecule that protects the cells. So we have in heel lifting, we have a tightening, we have a hydration, and we have collagen renewal in one product.
V5 tiež? Aj V10?
Počkej, V5 není polymer kyselá?
No neviem, ty si povedala.
And the real secret of V5 is trehalose. And I think loads of still, I would say, doctors around the world doesn't ever heard about the trehalose, which I'm always quite surprised because this is active ingredients which is really helpful. What the trehalose is, and let me explain this in very simple way how it works in this product. So basically trehalose acts like a protective shield for the hyaluronic acid. Normally standard HA stays in our tissue when we inject for about 7 to 10 days if we're lucky. And after this time, our enzyme natural hyaluronidase break it down and quickly remove. Okay? But when HA is combined with trehalose, the story is completely different. So trehalose literally surround the HA molecules and slow down the breakdown. So instead of lasting 1 week, this HA stay active for around 30 days. So that gave us two huge, I would say, advantages. First, the fibroblasts are stimulated much longer, which means better treatment results. And the second, skin holds hydration for a much longer time as well. So the tissue quality improves more visibly. And the top of that, trehalose is really strong antioxidant. So while it protected the HA, it also protects the cells around it from free radicals and oxidative stress, which again support healthy collagen formation. And this is why V5 works so beautifully, because the trehalose keep the HA alive for much longer. The HA give like structure and hydration, and together we can get a deeper, stronger, and I would say longer lasting regenerative effects. So this is the treatment which I usually do around 3 to 4 weeks, because sometimes, as we know, we have to repeat the treatment after 2 weeks. With this product, easily we can do after 3 to 4 weeks with really good results. So if we have a patient which they travel across to us, they don't have to pop into the clinic that much often. And also in HIV you have clear scientific proof. In vitro studies comparing products with trehalose show that regeneration increased by more than 25% faster in comparison to the standard HA formulation. So products which contain the trehalose, it will give us 25% quicker response of tissues. And if you wanted to push the results a little bit further, I actually prepared a little slide in here. We're not talking about the V20 today, but I was thinking I really like this. I really like this, connecting them together. So great option is combine V5 and V20. So V20 is 40 milligrams of high molecule weight hyaluronic acid, and to be honest, that makes a big, I would say, difference. The type of HA doesn't only hydrate; it actually behaves a little bit like stabilizer. So it holds water inside our extracellular matrix and helps the tissue stay organized. Because of that, the environment becomes much more friendly for our collagen to form. Okay, so V20 is not, I would say, replacing, and they're not really compatible together. They're not really like they're not competing together. They, I would say, support each other. So it's given like perfect stage for V5, and it's fantastic combination, especially for the patient with loads of, I would say, deformity of the tissue when we want to rebuild quick. It's amazing for the fat pad stimulation, and also for ligaments we can use it. If we have, for example, I would use that for the younger patients. Another element of changes with the age are superficial and deep fat pads. Okay, so they are a little different from each other, as you can see, and they little bit they also have a little bit different mechanisms. So superficial fat pads are mostly linked to our natural aging process. They gradually shrink, they lose volume, and that contributes the visible, I would say, collapse of the overlying skin. The deep fat pad also age, of course, but they are influenced by not only by the age, but also are very linked to our body mass. So simply speaking, the more body fat we have, the larger deep fat, but probably on the face we're gonna have that too. So how I can explain that really, I would say quick. If you're gonna imagine two people which you know, and one is really thin and one is a little bit overweight, you can easily see the person who is naturally bigger often look better in terms of wrinkles. So their tissue don't collapse that quickly because they still have those deeper structural support. So both types of the fat pads age, but they age in completely different ways. And the superficial fat pads slide down, like I said, with the age, but they also lost their volume. So, which is interesting through that fat pad around the nasolabial folds and the jawline actually gaining volume over time, because tissue from the upper face slides downwards and collect in this area, unfortunately. And this is why we always, when someone is around age 35, start having the nasolabial fold formation and little jawline, because everything is moving down. And also, how I previously explained, we have ligaments which are creating compartmentation of our fat pads, and when the ligaments really weak and we start moving our fat pads, everything is moving down very quick. But I just would like to go through this picture because I really like this picture. You can easily see how those fat pads actually disappearing from our age. This is what I was talking on the beginning about. We need to start work with a patient around age 30-35 and stimulate the fat pads, because in here we have face age 25, 45 and 65, and we can easily see on the 65 age we don't really have nothing to stimulate, okay, because the fat pads are gone, they melted down. So we cannot really help anyone who is coming, and we have to understand that we cannot really stimulate something which is not there. And in my opinion, that's the only replacement which we actually give the patient. That's the filler, because we cannot really recreate anything about it. So that's why it's so important to educate our patient and stimulate those fat pads, even they still full and they still in good condition, because we want to keep them on that high level. And also the deep fat pads, the one that I mentioned earlier, being partly depend of our body mass, also change, of course, with age, and they go through lipolysis as we get older. And today we actually have the solution for this as well. Scientists discovered that lipolysis relate molecules and hydration molecules. So all the substances which hydration our tissue are using exactly the same entry channel, which is called aquaporin 7. So imagine if we have two groups of molecules waiting to pass through the narrow gateway, the hydrating molecule and the lipolysis molecule. And if we, I would say, load the ship first with the hydration molecule, there is no space for the lipolysis molecule to enter. And this is why we can't enter lipolysis slows down, because we're gonna replace, I would say,
Čiže toto je na
the
kvázi takú
place
lipolízu.
with the hydration. So we put in the lipolysis on the red light. And in here, all the products which are really, really thin, they're really liquidy and they're really hydrating, it will be the best. So all the mesoline, it will be one, I would say, of the best choice to do and stimulate the deep fat compartments. How we can stimulate them? As you can see in this slide, we have four main deep fat pads. So I would go quite deep in nearly periosteum and put a little bit needle up, I would say 2 3 millimeters above the periosteum. So then we're gonna be in our deep fat pads. And I would go and inject every fat pad in 2 or 3 different places. It depends how much product we have and how much, I would say, deficiency of these fat pads we also have. And please take a moment to notice that what happened with our muscles as we age. And when we talk about the muscles, we are talking about the process called sarcopenia, and I think this is the process which is not, I would say, mentioned enough. Our facial muscles start to elongate, their tension increase, and their amplitude of movement becomes smaller. And this is really fascinating that the muscles of our face behave very differently from the muscle in the rest of our body. So our body more weak and our face more tense. And today we know we actually have two functional group in here. One is overreacted, and the other group the other group, I would say, is like weakening. So we have to have completely different approach to the stimulation as well. So we have a muscle here. You can easily see the difference. I will explain to you in a second. But first, I'm gonna mention like how we can work with the muscles. So basically, we have now amino acid complexes, and we have muscles where we also add, for example, choline as a precursor of acetylcholine. So we have V1, which will act completely opposite to the toxin, because toxin, it will relax the muscle, and choline, it will tense the muscle. So if we have a patient which they cannot really use the toxin because the muscles are really weak, or we even want to support the muscle, that's the very, very good option. I will prepare protocol for you in a second. I will gonna go through it.
Dobrá, v pondelok teda prípadne...
And also please look at the before and after photo in here especially. Notice like significant of drop of muscle. Muscle can be on the frontalis, and this muscle is not only responsible for movement, but it's also an important structural support. So we have to remember sarcopenia makes the whole facial framework stiffen and less responsive. So remember that with age, the using of botulinum toxin, which helps relax, of course, muscle is absolutely reasonable. So, but in my opinion,
táto stena není zlá. Tady to poznajú.
I would say, on
Že to
site
ale
from
bolo
relaxing
nejako všade
muscles
pozadie
only
proste.
with the toxin. The
Teoreticky
key
môže to
element
babie
is
dole
definitely
nahrať,
stimulating
Tak
the
ale proste
no, ale
muscle
keď to
taký,
to
môžu
maintain
pomakať,
the
taký
volume. So the
dvojminútový
larger the
vstup,
muscle
minútu a pol,
volume, the better
dvoj
in
max,
function.
kde
No to je-
povedia,
And this is
že
really
teda
truly
toto je ale
important,
proste pre hydro
especially in
a
our
je to úžasný produkt,
on our
má
field.
Ale
tých
každá k inému
ligamentách.
produktu?
So
Asi áno, lebo však produktov je veľa.
Hej, a potom sa to
we
môže
don't
začať
really have that
hakovať.
problem with
Áno.
our
Potom vlastne,
patient
keď to chceme, tak
saying
na
them
šírku to
no
chceme
if
asi
they
dať,
want to
tým
get rid
pádom,
of
keď
the
to chceme
wrinkles of
premietať.
the
Nie, to
forehead.
pôjde na sociálne
And we
siete.
also
Ja aj tak to
have those
Na výšku.
processes to stay in
Dobre.
balance. So already have
Ešte to prejdeme si
scientific
to
publication.
aby som to
I
mala
found
nejaký-
actually 3 or 4
na to nejakú štruktúru,
quite
že aby to
quite new.
zabralo,
I
aby
think
sa
that
neopakovalo.
from past
My
3-4
budeme
months,
musieť natočiť,
describing the
my
using
budeme
of
musieť
hyaluronic
natočiť
acid
niečo,
and choline directly in the
videá,
muscles
ako sa
are really,
ošetrí
really
protokol,
effective.
napríklad
And this is exactly what I actually mentioned earlier. And also combination of amino acid like BCAA complexes, which
To nám si
in
musíme aj naštudovať.
in selected
Tomu
areas
svetlo
might improve
napríklad.
the
Také
muscle
protokoly
quality too.
Dobre, ja si
Those
spomínam,
are
že by
actually
to
the
bolo
first
dobré, lebo
scientific
ako majú
report
dobré
on this kind, and they are extremely, I would say, valuable for us in the creating intelligent long-term treatment plans. And one more thing is this interesting of this, I would say, systemic level. You have probably heard of years of everyone saying our metabolism is slowing down. So we put in weight and our metabolism is slowing down. This is not true. All the science and all the, I would say, what we can find on the PubMed, what we can find even on the personal trainers now, which are follow the longevity, I would say, path, not only those normal which they used to work, because they, I can say, change the perspective of the work exactly the same like us. Metabolism of us doesn't really slowing down after 40. We're losing muscles, and the muscles and the energy of the metabolism is in our muscles. So when we're losing around 3% of our muscle mass yearly, the energy slows down as well. So that means even if we eat the same, we put in the gain. So that is so important to actually keep our muscle mass high increased for whole life, especially after 40. And in here, let's move to like a little bit more to practical part. And is there muscle stimulation protocol what I actually create? And this is, of course, not I create this. This is like work for loads of doctors, lots of studies, loads of reports. So it's not my work. And this is treatment which I choose infini VI. Even through the infini VI was originally made for the eye area, which is very delicate. The formula makes it useful in many other places, of course, too. And it contains a very smart blend of BCCA amino acid. And you probably know those from the gym. People drink BCCA after the workout to help the muscle recover and stay stronger. And this is exactly what we are doing here. We are giving the muscle the same building blocks, but in precise medical way, direct into the areas where the muscle is getting weaker with age. So they simply support the natural physiology and help the muscle to hold and function, I would say, for longer. So here we can see all the injection points and the full technique we use. So please take the screenshot if you like. Really, really good technique. Please let me know if you use it, how your effects. And this protocol is very clear, very organized, which help us work both with muscle are too active and with muscle that are losing strength and volume. And on this slide, we can see areas when we work the muscle stimulation. Here, the target, the facial muscle, the loss, the volume and quality with age, and all those little dots, that's the places when we're supposed to inject, and that's the muscle which we're supposed to support. All the depth amount of the product you have in here. And last element, which is really, really important with the aging, of course, is our facial bones. And we need to remember they will age as well. It's not that bones doesn't age. Unfortunately, they are. And please look on our jawline angle, but also look at the forehead area. We have like glabellar projection, we have widening of the nasal opening and the orbital opening. We also see the zygomatic bone coming backwards, the mandible moving backwards, and the jaw angle become flatter. So what does it mean for us? So it means that the soft tissue above there losing their support, of course, because bone is our first scaffold. It's our foundation of the entire face, just like the foundation of the house. And if you imagine that the foundation under your beautiful house starts shrinking, rotating, changing shapes, and becomes smaller and every year, it's obvious that house built on such a foundation will start to have the problems. So it's exactly the same with our face. And that's the specific actually plan when we need the fillers. Nothing else I can able to rebuild those bone projection. We cannot really stimulate. We can stimulate fat to improve quality. We can stimulate the muscle. We can support ligaments, but we cannot really do much with the bone. I think those. I think that start some clinical studies around the world looking into hitozen for the bone regeneration, which is very, very interesting and quite promising. But I think as of today, we still do not have any confirmed clinical solutions. So when we talk about the fillers, in this context, they become, I would say, the finishing touch, and that's the only solution for this area. And of course, on our face, we don't only have the deeper layers, we also have an eye area and the lip area, and they both age very fast. So those tissues are extremely delicate, so they need regular care, and I would say start looking after them, the better results we get earlier than leave it to the last minute when the area is very struggling, when the skin laxity is really high level, when the wrinkles are visible. So please do not leave that. And when we have a patient in our clinic and we do any treatment, any facial stimulation, any toxin, and we can see the eye area start decreasing the volume, please suggest you and educate your patient, because this is what we actually having the most problems, and I can see the most problems. For years patients haven't been advised by us doctors to do anything apart of the toxin, and now it's a little bit sometimes too late. They would like to improve the skin, but we cannot really help them. And the second area of the very delicate area, which also age, are lips, of course. And this is really interesting product, Infini Lip Plus Vital Booster. And this is the products which I was also waiting for. I was really excited because I was needed something which gonna be really thin consistency. So I'm not gonna give my patient loads of volume, I'm not gonna give them any swelling, and I'm not gonna bruise them, because most of our patients, when they come, they don't want to do anything with the lips because they're scared of bruising, they're scared of, I would say, swelling. And this is amazing because the product is really thin, so you can easily use with a 34 gauge needle. I use it with 9 millimeters, so it's pushing beautifully. So basically, you have painless treatment with no bruising, no swelling. is contain hyaluronic acid 20 milligrams per 1 ml, but it's non-crossed, so it's not gonna give you a volume. It will give you loads of hydration. It's also peptides there, which will tighten in the skin, and vitamin B12, which will increase the circulation of the tissue. So that means if someone would like have a little bit more redness of the lip, that will give that to as well, because the circulation it will be higher. So this option is great, like I said, for clients who think about the lip augmentation, but they're not really sure yet. This treatment gives us a soft, natural improvement, and it also is excellent as a revitalization for the lips after dissolving all filler with hyaluronidase to rebuild the tissue. And sometimes rebuilding the tissue it's really, really important to prevent the migration if we're gonna add another volumetric filler in that same, I would say, expanse empty space. So this is really important to have a little bit of gap in between treatments. And as we know, our patients are really, really impatient now. On those days, they don't want to I would say live without the lip filler. They feel uncomfortable, and this is what actually helping me to reduce that time, because the regeneration of the tissue is much quicker, and also giving them a little bit of, I would say, volume from attracting the water to the non-hyaluronic acid component in this product. It will give them a little bit, I would say, fullness for some time. And also we have eye area, as I mentioned. It's really crucially important to start to stimulate this area. Very important. My product of choice for today is Infini VI. So we have fragments of hyaluronic acid and amino acids in here. So it's perfect for collagen type 3 stimulation. I love protocol combining this product with Infini Eye Booster, because Infini Eye Booster does the stimulation of collagen type 1. So if I have someone who is coming and having like visible problem with eye area, I usually combining those two products and using one of each for every treatment. So for example, start with Infini Eye Booster. So I will recreate collagen type 1, so the strong collagen, the structural collagen, and also Infini Eye Booster contain the glutathione, so that will give beautiful brightness under the eyes. The second treatment I will do with Infini VI, so I will create more fibroblast and collagen type 3. Then I will follow another treatment with Infini Eye Booster, because I will again stimulate collagen type 1, not only from existing fibroblast, but also from the new one, which I create with Infini Eye. And as a last, I will go with Infini Eye to close the session. I would say to stimulate as much fibroblast I can. So for the next 12 years, the skin might remodel and actually having visible effects much more better than even after, I would say, one of those products we use on their own. So treatment protocol for VI is very simple, and in practice is almost painless for the patient. Of course, we always start with the cleansing, disinfecting, and applying the topical anesthetic, because it's the eye area and extremely delicate. We have to be careful, okay? Amount of product is very important. So first of all, we have to work gently and very precisely. We have to be careful not to overload the tissue with too much product, because so many times we can see the complication with lots of puffiness, with lymphatic draining stagnation, because when we have 2 milliliters of the product in syringe doesn't mean we have to use it. I wouldn't go more than 0.3 milliliter per eye, I would say, for the lower eyelid, then around 0.1 milliliter on the top eyelid, and around 0.1 milliliter under the brow arch to support the orbicularis oculi muscle. So in total it's around 0.5 milliliter per eye, and it's more than enough for the first session. After first session, we can see how the patient react. I usually stay on that level, not really giving more, and I can see you having the better result using less product under the eye area than using the more product. You can easily use length of the needle. It depends how do you like to work. 34, 32,
Halo?
30 gauge needle will be perfect. The
Ja som ešte v
product is
klinike
very
bola na
thin.
online
We just need
webinári.
to remember that we need to go to the dermis. So that
Ale
means
hlavne som
dermis
ako...
on the eye area is on a depth around 0.6 milliliters. So
Ne,
when we
počkaj,
go in
ja už
with the
prídem,
needle,
potrebujem
we
to ukončiť.
basically putting only the bevel to the skin and releasing the product. So then we're gonna be in correct plane. So when we look at the whole process, we actually have like answers for every single tissue layer, and not even, I would say, talk through all the infini range, because probably I could go through every single product and put to the right category of the stimulation, because that is so easy with infini, as they given us such a big, like I said, toolbox to actually cover every product problem, not only the structural problem, but also pigmentation, also inflammation. We have PDRN, which will give the inflammation and slow down and healing effect. It will be increased. And like I said, the succinic acid, which will help with microcirculation and lymphatic stagnation. That's the perfect. Also, so how to start? Because usually when we have this kind of chat, everyone's saying, okay, where to start with? For me, ligaments, that's the most important, and we're always supposed to start with the ligaments, as even if we start stimulating fat compartments, that might not be the best way if the ligaments, they're all over the place, and the compartmentation of those paths cannot be held, because the ligaments are really struggle. So first ligaments, then superficial fat tissue, then deep fat compartments, muscles, and skin stimulation. So as you can see, our patients are never-ending story. They will have to come back and do that all again, like we do for ourselves. I can't imagine do one treatment per year and expecting fantastic results. This is impossible. Let's be honest. Unless we just lucky genetically. I'm unfortunately not. So I try to keep my regime of treatments very high, and I using mesotherapy every 6 weeks, and skin stimulator every 2 months, and do every structure each. So little results in here. So on this slide, you can see the effect of the ligament stimulation, and all of those results come from the session of 4 treatments. Here I focused on the facial ligaments and rebuilding the anterior cheek projection with only stimulation. So we recreated the fat pad. And this create a much better lift and improved the oral contour for the mid-face. So you can see the marionette line and nostril folds actually looks really good. My patient was really happy with result. So in here, like I said, that was a combination products I used in here, Infini V5 plus Infini V20. I mixed them together using the connector, female to female connector, mix them together. So I had 4 milliliters of the product. So for me, that was really easy. Use that for ligaments and the tissues and the fat pad stimulation in one day. And in here we have also the ligament stimulation. After 4 treatments, you can see how that's the free actually treatment, because she came for the 4th treatment before we, as she's not living in UK. So we can see improvement of the facial ligaments is absolutely amazing. And also in here, we've been working on the skin texture and the ligaments, and also this patient, she has a little bit of toxin on the jaw area, to little bit I would support. She haven't lost any weight, she's still the same. It's just reposition, I would say, of the muscle tension and the ligaments. And that same in here, we have the reposition with the ligaments. How we can see the results are really, really impressive and really, really nice, especially on the noselabral fold and the marionette lines. And on this lady, we've been working only on this area, as that was her the main problem. And in this, I used combination. So first I used V5 with the cannula, and I went all around the area using the cannula and using whole 2 ml around the area. And on that same treatment, also I used infini V1 with Holin, which I injected direct in the muscle to little bit support the muscle, which you can see they shrink a bit and they quite weak. Those kind of patients which they have a problem with mouth area and they really dehydrated. So that's the first thing, they not really hydrated and they not drink enough water. So first thing what I usually ask, do you drink water? And they always say, how do you know I cannot drink the water? Because I can see that. So this area first is the most visible area if we are dehydrated. And we have to explain to our patient, product is 30%, us as the injectors are 30%, and 40% that's from them. If they're not gonna follow the rules, if they're not gonna change the lifestyle, we cannot give them effects which they expect, because everything which we're gonna create, they will basically break it at home. So we have to be quite honest with them, and that needs to be, I would say, a cooperation and not only one side work. And in here, I prepared also like a few protocols based on the client's real needs. So you can take a screenshot and you can use it in your clinic. So here we have the set of full face protocol designed for, like I would say, patient who wants more fast and visible results. And we can work with different combination depending on the level of lifting, what you want to achieve. So the first treatment, it's going to be with infini V1, V2. Infini V2, that's the fragments of hyaluronic acid with glutathione in vitamin C. So it's beautiful, I would say, glowy product, which will give lots of brightness, lots of glow, lots of freshness of the face. And also it will be really good for the pigmentation. And then after 2 weeks, I would do one treatment combining V2 and V1 with 1-to-1 ratio. Third treatment using a 5-point BAP technique with infini V20 or V5, is depends of the of course the patient needs. And also on the areas of the crow's feet and the neck, I would use infini V1. Amount of the products which I use, I'm gonna be honest, when I'm using with V-line, I use whole amount of vial. So I'm using 5 ml for whole face. I'm not really using less. I like quick results. My patients really happy, never had a complication to March or anything like that. And like I said, 5 ml for face is absolutely beautiful results. Sometimes I'm using 4 ml for face, and then 1 ml only on the, I would say, only this kind of like turtly neck. Some women having really loose skin, so I'm injecting 1 ml in here to support, because what I can see a lot, especially on the social media, lots of the doctors injectors, they finish the treatment around the jawline, and this is not really great, because we have our face actually up to here. So please, dear colleagues, when you do the treatments and you don't finish your, I would say, stimulation on mesotherapy on the jawline, go one line like below. Okay, so we have like nice and smooth transition line, instead of like having beautiful skin on the cheek and then in here not really not really great one, especially if we have a patient which they don't really want to look after the neck. And we have a glow up protocol, so that's the combination infini V2, like I said, glutathione, vitamin C, fragments of hyaluronic acid, and infini pill, 20% TCA. So first pill, then we raise in and inject in the V2, series of 4 treatments every 2 weeks. Pure skin protocol, that's infini 1 plus infini pill. So infini will give us a beautiful brightness of the skin, and infini 1, it will give us a little bit of tightness. And eye protocol, I explained you already. So if we can mix the treatment, so we can do one with eye booster, or we can do with V1 if we have quite loose skin, because V1 containing choline, it will little bit tighten up. And thank you very much. That's all what I actually prepared for today. I'm really sorry that it was so long. I will stop sharing my screen now. So I will have a look what questions we have, and I'm gonna answer some questions now, and then we're gonna do, I would say, 5-minute break so we can go to toilet, or you can go to toilet, or we can just drink some water, and I will prepare my patient, and we will and I will show you the full face treatment. I'm gonna show you stimulation of ligaments of the skin, eye area, lip booster, and also a little bit of muscle stimulation of the forehead. So I'm gonna go through quickly for those questions, if we have any. So can we talk about a little bit V products? So we did a little bit. If you have any question, of course, you can also send me some message on the Instagram. Feel free also to contact me on Instagram. I'm always happy to help. I am interested very much in microneedling serum and how deep to use those serum that would be effective. Okay, with microneedling, it depends what we want to achieve. Of course, we have to understand if we don't really have the major problem of the skin, the microneedling don't really have to go deep. 0.5 would be enough to actually achieve really, really good results, unless we have a pigmentation, unless we have a scarring, unless we have a like pores and everything. So this would we have to, I would say, a little bit more focused on the areas of the problematic areas. What I highly recommend is the better results. What to do is first microneedle on the, I would say, dry skin, because we've been learned for years that first we have to apply the product, then we have to microneedle, and then we have to apply the product. And this is not really correct, because when we have in quite, I would say, wet surface, so we have this sliding and gliding and everything, and that's fine. But we all know that we cannot really drag the dermapen. We have to go stamp one by one next to each other, because when we drag it the skin, and we creating micro scarring. So we don't want that. Doesn't matter if even if we're gonna go 0.25, we still gonna damage the tissue. So we have to one by one go next to each other. So do that on, I would say, dry skin, because dry skin you can hold and you can go actually on that depth which you want to go. It's not that painful for your patient, because you're not dragging that, and then straight after put the product on it, because the skin's open for around, I would say, 11 to 14 minutes after the microneedling. So that's the time when we have to actually focus on applying the product, if we want to combine with the product. But with the microneedling also, you're going to have amazing results without any product. Or if you want to have much better result, first apply the peel. Infini, you can use the infini peel, I would say, for 2-3 minutes, raise it off, and then do micro needling. Of course, peel needs to be applied for the skin which is suitable for the treatment. Hopefully that help. If you have any other question, feel free. I will, of course, answer. Can we use F6 by Dermapen? No, I wouldn't recommend that because the F6 is quite thick product, and we have to remember microneedling needs to go for the micro channels, and the cartridges with the Dermapen they have really thin needles, so that means we need the product which they quite thin, so the liquid it will soak into the skin. If we're gonna put and like a cream or something which is really thick, doesn't really go anywhere because it's too thick. No, won't move. Even if you're gonna take two products and you're gonna put next to each other, and you will actually like swap the dish when you put the products, one of them will run down, and one will stay in the place. So it's exactly the same with F6 because it's too product is, I would say, too thick. It would be like a waste of product injected with much better results. You're gonna achieve that. For the microneedling, amazing collagen, normal collagen, collagen max, amber, and HA. Fantastic results because we need to remember that for the collagen production we need the coenzyme, we need the vitamins, we need everything. So the NHA is the perfect for this kind of treatments. The best product and company. Oh, thank you very much. If lady is more than 65 years and do not want any fears, what's your suggestion? Okay, you can try rebuild a little bit with V5 and V20. If she's open for more hard stimulation, you can try V10, which is like polylactic acid, because that will rebuild a little bit thickness of the skin. If she's got some health conditions and she won't be suitable for the V10 polylactic acid, try to little bit support the tissue with the V5 and V20 combined together, or V5 and, for example, VI, like mixed together, like with the, I will show you in a second, you have like little connectors like female to female and you can mix product. So if you combine, for example, 2 milliliters of V5 with 3 milliliters of VI, so you have a fragment of hyaluronic acid and you have a trehalose. So that means you will stimulate the new fibroblasts. You're going to stimulate collagen type 3 from VI. And this all, it will be protected by trehalose. So that means the effect will be much quicker and better because the rebuilding process, it will last much longer because of the trehalose. Could you tell about infini Botox using with microneedling? Okay, so infini beta X, that's the peptides. So we can use with the microneedling and giving beautiful, I would say, tightening effect. So, but like I said, first go without any product, dry. Do like nice work with microneedling, I would say correct work, and then on it put the BTX, and it will be really nice tightening effect. Usually I use around 3 ml for the whole face, so 1 ml, 1 ml, and 1 ml with microneedling, no more. I like to ask if we can mix the boosters. Yes, I mix the boosters. I actually mix most of the products of Infini. The only thing which you cannot really mix is, for example, V1, which contain choline, and Infini Beta X, because BTX, it will relax the muscle a little bit like Botox like, and Infini V1 choline, it will tighten the muscle, so they antagonists, so they not really work together. But you can have really good effect if you're gonna inject BTX through the jawline and you're gonna release the tension like we usually do with the toxin, but with BTX, and then you're gonna inject around all the cheek area V1, because that will tighten the skin. So you're gonna have amazing results too. Of course, we need 3 to 4 treatments. The results won't be last long in, like the Botox, but you can see a visible improvement, especially for someone who don't really want to have such radical solutions or want to have quick results, for example, for event. Thank you so much. A fabulous dose of innovation can my clients can write the Instagram. Of course, I will give you my Instagram in the second. Does microneedling help over? Of course, it will help over 65 because we will need to remember microneedling is also mechanical stimulation of our fibroblasts. So as much we stimulate in more, the skin response is much better. So let's stimulate them from every side. And for those patients, I usually combining those together. So I first do microneedling, and usually I then injecting the product on that same treatment. So you have also fantastic results. And this is okay to use the Botox after deep microneedling. If you, I'm not sure, doctor, if you're talking about the toxin or you're talking about the BTX infini, please specify that, because that would help me. If you want to use toxin, like normal toxin, what I do, microneedling on 0.75 depth, and then I take in 3 ml of NHA and mixing with 50 units of toxin in a vial. Okay, so when you have 50 units of toxin, so I'm not using the saline solution for the mixing. I put in 3 ml of NHA, and then 0.75 microneedling, and on the top you can put the Botox with the NHA. Beautiful results, really good tightening of the skin, post shrink, and also that's going to be amazing for someone who's got oily skin, because post it will be regulated a little bit. BTX Botox, yes. So hopefully I owe that. What is the correct depth for fibroblast stimulation in microneedling? So fibroblast located in the dermis, okay? So that means we have to go 1.6. That's the our depth. But with microneedling, of course, we are not able to go that far. But with the microneedling, we don't want to go to the dermis. We just want to basically stay in here. So when we have our skin, and that's our dermis, hopefully you can see. So we want to be still in here with our microneedling. We don't have to go deeper, because that's a completely different type of fibroblast stimulation. That's the mechanical, I would say, stimulations. Exactly the same like a needle. Every single time when we needle the skin, we actually mechanically stimulate the fibroblasts. That's why I don't really usually use cannula for mesotherapy, because I'm losing this impact for the skin of stimulation from the needling. So it's exactly the same. Even if you're gonna go like 0.75, you're gonna be, or 0.5, you're gonna be, I would say, already for the fibroblast stimulation stage. Right, so I think that's all what we have. Let's say 5 minutes. I will put my camera down and I will swap for devices. I will prepare my patient quickly, and then I will go back in basically 5 minutes. Okay? So see you soon.